Hi, my name is Lucinda Evans and I'm a final year MSc counselling student. My dissertation is on LGBTQ+ influence and representation in counsellor training curricula. There has been very limited research exploring LGBTQ+ perspectives on counsellor cultural competency, and the present research shows us that many counsellors lack adequate knowledge of LGBTQ+ issues. This has led to biased attitudes and heteronormative assumptions. This study aimed to explore LGBTQ+ perspectives on counsellor cultural competence and identify areas for further improvement for counsellor training. 61 participants who all identified as being part of the LGBTQ+ community completed an online questionnaire. And the results and the findings examined how important it is for counsellors to receive specific LGBTQ+ competency training and highlighted future avenues and recommendations for research. So, what does the present research tell us about LGBTQ+ individuals and counselling? Well, the research has found that LGBTQ+ population do experience higher levels of mental distress than their heterosexual counterparts. As a result of this, LGBTQ+ individuals access counselling at a greater degree, engaging in a higher level of therapy sessions. Counsellor training should address and incorporate cultural competencies when working with LGBTQ+ clients. And it was found that counsellors lack the specific training in working with LGBTQ+ clients competently, and as such, some LGBTQ+ clients were left feeling judged or misrepresented by their counsellor and in their therapy sessions. So there are many barriers that the LGBTQ+ population face when accessing counselling, but one of the most prolific ones is inadequate training in cultural competency. Research also suggests that there needs to be a greater understanding on specific issues affecting the community, such as mental well-being, gender identity development, and the societal and psychological pressures of coming out. Cultural humility has also found to be a factor, and this can be defined as the involvement of both intrapersonal and interpersonal characteristics to develop mutual collaboration, particularly in therapeutic settings. And another factor is the minority stress model. This can be defined as the social, structural, and psychological factors that underpin inequalities in treatment for minority populations. So what about lived experiences of counsellors who themselves identify as being part of the LGBTQ+ community? So although lived experience has a positive effect on therapeutic relationships, more in-depth training was required. And research suggests that the counsellors who do identify as LGBTQ+ do require the same LGBTQ+ training as heterosexual therapists. As mentioned at the beginning, there is limited present research considering personal reflections in the LGBTQ+ community. And so this exploratory study explored the extent that LGBTQ+ voices can shape counsellor training curricula and whether current counsellor training is adequate and reflects the diversity of LGBTQ+ experiences. So in the study, 3 objectives were investigated. Objective 1, exploring LGBTQ+ clients and prospective clients' perspectives on counsellor competency when engaging with their community. Objective 2, gaining LGBTQ+ perspectives on current recommendations for LGBTQ+ counsellor training. And Objective 3, obtaining further insight into what the LGBTQ+ population would like to envisage is included in future training, in addition to the current recommendations. So 61 participants who all identified as being part of the LGBTQ+ community, which was the eligibility criteria for the study, took part. 50 were recruited through SONA, the student panel here at Bangor University, and the remaining 11 were recruited through social media sites and word of mouth. The study adopted a mixed methods design using an online side toolkit questionnaire consisting of open, closed, Likert and rank order scale questions, and the participants answered the questions presented to them on a computer screen via the online questionnaire link. So participants accessed the questionnaire via the SciToolkit platform, and there were 28 questions in total. Some did have conditional jumps online. Examples of the questions were: how important is it to you that your counsellor is part of the LGBTQ+ community? And what topics do you feel should be prioritised in future training for counsellors working with LGBTQ+ clients? It was a relatively straightforward procedure. Participants were first presented with an information sheet outlining the study and its objectives. Consent was then obtained. Questionnaire was completed and a debrief presented to them at the end, which did provide signposting if required. Signposting to student wellbeing services and LGBTQ+ services. The study adhered to the BPS and BACP and NCPS guidelines for ethical research and practice and was approved by the Bangor University School of Psychology and Sports Science Research Ethics and Governance Committee, and it was number 1170. So all participation was voluntary and all participants had the right to withdraw at any time. The study involved no deception and there was no monetary remuneration offered. Participants that signed up through SONA did get issued 1 SONA credit upon completion of the study. There was no significant risks identified to participants. As mentioned in the previous slide, signposting to the student wellbeing services at Bangor and LGBTQ+ services were available in case of any minor transitory discomfort. And all responses were anonymous. Participants' responses all had a different number issued to them, so no identifying data was submitted, and all the data collected remained confidential and was immediately deleted upon submission of researchers' dissertations. So, what did the study find? 67 participants actually completed the online questionnaire, but 6 participants' data had to be excluded as they did fail to meet the eligibility criteria. So the data therefore was analysed for the remaining 61. LGBTQ+ competency was ranked as the most important training topic, followed by grief, addiction and cultural competence. The majority of participants were unsure whether their counsellor had attended prior specific LGBTQ+ training or whether their counsellor did identify as part of the LGBTQ+ community. And despite the majority feeling both affirmed and understood by their counsellor, some had encountered negative experience in previous therapy sessions due to their LGBTQ+ identity. So 4 participants did give their reasons for their previous negative experiences, and these were the client feeling misrepresented, the counsellor not understanding the client's issues, the client feeling dismissed, and the counsellor holding unacceptable views on their sexual identity. The majority of the participants in the study indicated it was vital that counsellors receive specific LGBTQ+ competency training prior to working with clients. However, they did state it wasn't important for their counsellor to identify as part of the community. And participants have viewed the current training as being insufficient and did express a desire that cultural competency training be a mandatory requirement in all training programmes going forward. So for the 8 topics on the questionnaire, which were minority stress theory, non-binary and gender diverse identities, transgender specific mental health, asexual and aromantic awareness, intersectionality, supporting coming out, religious trauma and ethical and legal considerations, the majority of participants were either unaware how well covered these were currently in training programmes or felt they were only moderately covered. The topics participants would like to see prioritised were mental health awareness, the coming out process and the impact within families, family relationships, trauma, estrangement with family, religion, discrimination, stigma and intersectionality. And additional topics suggested including diversity within the community, gender and sexual differences, unconscious bias, and a greater emphasis both on training on pronouns and counsellors providing a welcoming space without judgment. So, what did the present study find? Well, it met all 3 of its research objectives in that it explored LGBTQ+ clients and potential clients' perspectives on current recommendations for LGBTQ+ diversity and inclusivity training for trainee counsellors, and gain further insight into what the LGBTQ+ population would like to see included in training, in addition to the current recommendations. The study supports current research in that LGBTQ+ competency was ranked as the most important training topic for counsellor training, followed by grief and addiction. Research has suggested that LGBTQ+ individuals are more than twice as likely to engage in substance use and display higher rates of alcohol and drug dependency than heterosexuals, which reflects the need to increase awareness and training support to address this disparity within the LGBTQ+ community. And in line with current research, the study suggests that LGBTQ+ cultural competency training becomes a mandatory requirement for all trainee counsellors. Currently, cultural competency training is only mandatory in Washington, DC in America. So some participants did report judgmental experiences from previous counselling, and this supports previous research into a lack of understanding from counsellors towards gender and sexuality. As mentioned in previous slides, it is explicit counsellor LGBTQ+ training that is the key, rather than lived experience of LGBTQ+ counsellors. The study reinforces the requirement for deeper substantial counsellor training regarding intersectionality, stigma, and unconscious bias, and with the fact that all participants either did not know how well certain topics were covered or thought they were only moderately covered, it highlights the lack of awareness into how well LGBTQ+ topics are actually covered in current training programs. So topics that participants would like to see prioritised going forward. The prioritisation of religion as an LGBTQ+ training topic is interesting, particularly with world affairs presently, and is in support of the current research into those affiliated with a religion holding antagonistic attitudes towards the LGBTQ+ population and professional concerns raised over those having secular beliefs and LGBTQ+ identification. Another topic participants would like to see prioritised for future LGBTQ+ counsellor training is variety of LGBTQ+ orientations and neurodivergence. Past research has found a significant intersection between LGBTQ+ community and neurodivergent individuals, and research has suggested people with autism are 8 times higher to identify as LGBTQ+ than neurotypical individuals. A further additional topic suggested was diversity within the community. This again highlights the requirement for further extensive training on intersectionality for trainee counsellors to enable them to be able to avoid prejudice and disparities when working with LGBTQ+ clients. Unconscious bias was also suggested as a topic for training inclusion. Including this is crucial for avoiding social stigma within therapeutic settings, safeguarding clients and enhancing mental health outcomes. Including training on pronouns further supports the requirement for more extensive counsellor training when working with gender diverse clients. And since LGBTQ+ individuals often experience discrimination and minority stress, they may fear, even when no explicit bias is shown, that a counsellor may have unconscious stereotypes or bias that could influence the quality of their therapy. Misgendering clients could also breach one of the BACP's core principles of non-maleficence, which is do no harm, by causing harm to the client. So it was also suggested training programs continue to focus on treating LGBTQ+ clients with the same respect and congruence as they would with heterosexual clients. So some limitations of the present study. It was a relatively small sample size of 61. It was a skewed sample as the participant majority were Bangor University students and student population. There was limited recruitment options. It was only advertised through Sona and a few social media sites. So it meant it attracted a more generalised demographic, and future avenues and recommendations for research are suggested in the next slide. So some future options for Future research could include studies involving a broader sample of participants may demonstrate greater validity, depth and breadth of findings. Future research could target a more general population through wider recruitment options such as professional networks like LinkedIn, community outreach and snowball sampling. Future longitudinal studies focusing on client outcomes with counsellors who are trained in LGBTQ+ inclusive curricula would provide more succinct and extensive evidence into how effective training programmes are and whether they result in better and more successful therapeutic outcomes for LGBTQ+ clients. And it may be of some interest for future research to compare LGBTQ+ and heterosexual individuals' perspectives on counsellor training curricula to build upon current findings. So, to conclude, the present study has demonstrated how integrating LGBTQ+ perspectives into counsellor training curricula is essential for ethical, inclusive and effective client care. By prioritising lived experiences, challenging heteronormative assumptions and embedding cultural competent frameworks, training programmes can better prepare counsellors to support LGBTQ+ clients in the future. And future training programmes must adopt co-production with LGBTQ+ communities and implant continuous reflection to ensure counsellor training is truly inclusive, affirming and socially just. And the take-home message of the study. So the study highlights that while awareness of LGBTQ+ issues in counsellor training is growing, representation in curricula remains inconsistent. By embedding comprehensive LGBTQ+ perspectives is crucial not only for fostering inclusive professional practice, but also for equipping future counsellors to work competently with LGBTQ+ clients in the future. And bringing about meaningful training programme reform can bridge gaps between policy, training and real-world client needs, ultimately promoting more successful and beneficial therapeutic outcomes going forward. And these are the references of the slides. Thank you very much for listening. Thank you.